Hi, my name is Margaret. I'm from the Don't Punish Me Rally Organization, and I'm also from the PA State Page Organization. And I'm here to give my video today about the plight of chronic pain and chronically ill patients today in America. I am a 15-year sufferer of chronic regional pain syndrome, which, if you don't know what that is, it's a very painful illness, one of the most painful known to man, more than even cancer or childbirth, and it's very difficult to treat. I've been suffering for, like I said, over 15 years with it. I also have neuropathy, fibromyalgia, osteoarthritis, and I have duodenal disc disease. I've had 6 hip surgeries due to multiple steroid injections that I had back in 2010 that damaged the bones of my hips, and I ended up needing surgery at the age of 40. I also had knee surgery, ACL surgery on my knee, and I have chronic residual pain in both my hip and my knee. I am here because I'm tired of people are suffering. People are being cut off their medications due to the CDC guidelines and the DEA witch hunting and harassing of our doctors. Doctors are afraid to prescribe. Doctors feel their hands are tied, and I can understand, but it's still not right. So many patients have had their meds just abruptly cut after 10, 15, 20 plus years of being stable, like myself. Before 2016, I was on long-acting and short-acting medication that was actually effective. I was having a quality of life. I was able to go to my therapy program. I was able to do aquatic therapy, short walks with my husband. I was able to drive myself to my appointments, enjoy family time, somewhat take care of my home. Now, once the guidelines came out in 2016, my doctor felt that he had no other choice but to take away those meds. I wasn't given a warning. I came in one day and was just told, and imagine that, coming in one day after being stable on these meds, responsibly taken, you did nothing wrong, and told that I can't give you those anymore. Imagine being a chemo patient and told, or a diabetic, that, well, we can't give you your insulin anymore, but you got to go home and figure it out. And patients are having this happen to them, including myself. So unfortunately, I did have to go on medications that he felt, the lowest dose, that were less effective, way below what even the CDC recommended, because of the DEA and the DOJ harassing the doctors and deciding what's best for us. Everyone's deciding what's best for us, who have no knowledge, no education in chronic pain. They're suffering, or they're practicing medicine without a license. And it should be between our doctors and us. Our doctors know us and know what we've tried and what we haven't. We know what we've tried and what we haven't, and what works and what doesn't. I've had so many treatments, so many to list. I've had injections, I've had trigger point injections, I've had epidural, which actually are not approved by the FDA but are used off-label quite often now in treatment of chronic pain, intractable pain. So many people are suffering horrific pain, barbaric treatment, acute patients after surgery, veterans, or having their limbs blown off, or major burns, are giving nothing but Tylenol. So many suffering, and it's heart-wrenching. The story after story that you're here today, like I said, quite stable patients, and these are people we are 40, 50-year-olds, 60-year-olds. That we are not drug addicts. We are seeking pain relief, not a high. We don't get high. We don't have euphoria. We don't feel any of those things. We feel relief, that maybe we can breathe for a second, that maybe we can go to the store, or go to church, or enjoy that family time with our grandkids. or my husband just to do my dishes, or somewhat take care of my home, just to get out of bed and get dressed. For many, just to go to work and provide for their families. And you now have people going on social, they have to file for disability, they have to file for Medicaid, Medicare. Like, how is that responsibly helping our economy? It's not. Patients of pain patients are dying. They're committing suicide because they just want relief, because they're either untreated completely or they're treated undertreated. So many, the insurance companies are deciding, or you have to worry about the pharmacy deciding that they're not going to fill your script that day. Insurance companies don't want to pay for it. We can no longer pay for your medication. And it's all everyone else deciding. And it's a time that we need legislation to protect our patients and to protect our doctors, so that doctors are able to prescribe without fear of prosecution or ending up in jail for life, while our illegal drug manufacturers are getting 10 months, 15 months probation. It's not right. These are innocent doctors who are just trying to ethically treat their patients. And then we have patients who are just trying to live. We just want a quality of life. That's all we are. And tolerable pains, so that, like I said, we can breathe and enjoy our families. And that's why this is so important to me. And that's why I'm doing this today. Because all of our rallies were canceled due to the coronavirus. Trying to be safe, and many of us are, compromised on top of everything. So, and we're still having to go to doctor appointments because we can't get our pain medication without seeing a doctor. We have to get injections or to get our medications. We have to do urinalysis. We have to do pill counts. We're monitored very closely. I responsibly have taken my meds for the 15 years. I've always kept them safe. I've never diverted my meds. I don't sell my pills because, truthfully, we need them. So I just wanted to let my story be told, and hopefully we can get legislation in every state to protect the chronic pain, intractable pain patient, the non-cancerous chronic pain patient as well. Because just because we don't have cancer doesn't mean we don't have that horrific pain, or we don't suffer from a horrific pain the same. Everyone deserves treatment, not just one, or we can't be picking and choosing. Everyone deserves to have pain treated. It's a human right. It's a basic human right to have your pain effectively treated and to have a quality of life. So, I just want to stand here, like I said, for the Don't Punish Pain, and this is our group, and support one another, and hope that one day this can change, and it needs to stop. The suffering and barbaric treatment needs to stop. Thank you. How does that sound?